Hey Carrie, I completely agree with you. Teaching patients is very important. Having the nurses, the doctors, and everyone kind of be on board with educating the patients on why they're being started on those opioids, how long they're supposed to take them, and why they're taking them. A lot of people don't really understand how they work, or how, just taking them for a couple days isn't going to necessarily cause you to become addicted. I do know that a lot of people who are affected by the opioid crisis say that it just started out with a couple pain meds that they received after a surgery or an injury of some sort. I find that to be a common claim, especially among my patient population. I feel like that with my patients in a psychiatric setting, we do try really hard to tell them why they're on these meds, or how they're supposed to take them, signs and symptoms to watch for, and other type of ways they can manage things necessarily without taking a medication. We don't really use too many pain medications at my facility because a lot of them are addicted, so we do steer clear of that unless someone came in and had just recently had maybe a broken arm or something like that. They may be on like a very low dose of Loratab for 3 days. So I don't really give too many pain meds outside of ibuprofen or Tylenol to my patient population, but I do know that a substantial amount of them come in either withdrawing, or dealing with an actual opioid addiction. So it is nice to educate them on ways that they can avoid having to even take a pain med. I do like how you brought up heat therapy, or other ways that aren't necessarily, like you said, taking a medication, because even aspirins and Tylenol, it's still it's still a pain relief. It's still, and you're taking it by mouth. Sometimes that alone just makes a patient crave their, original vice. But I really enjoyed your post, and I like how you made the point that it kind of starts with the doctors that are prescribing the meds, and then the nurses who are administering them and educating the patients on why they're taking it, what it's for, how it works, how long they're supposed to be taking it. Don't take it if you don't absolutely have to. There are other ways to relieve inflammation and pain, and some pain is good pain. I think people think that feeling nothing is what the goal is, and that's not necessarily true. You should actually feel something in order to know if something's maybe going wrong. But I really enjoyed your post, and I think it helps all of us as nurses to really see that a lot of teaching really does fall in our hands, even outside of the doctors that we work alongside with. We interact with the patients more. We're hands-on right in there with them, and we can really influence people in a positive way by being educated ourselves and then really thoroughly educating them. Thanks. Bye.